Veterinary medicine is a messy business both physically and emotionally. Vetsplaining is one veterinarian's attempt to explain and understand her own profession a little better. Join Dr. Lisa McFaddin as she delves deep into the medical and business aspects of veterinary medicine.
Vetsplaining 2019. Welcome back, guys. We took a very brief hiatus just for the holidays, and now we're back. And for our first episode, we are going to attempt to address the question posed in the title of this episode: why do veterinarians run behind? And I think it's a very important topic to discuss and explain, at least from my perspective. And I think that it is a kind of talking point that I know is very frustrating for all parties. You know, veterinarians don't like running behind. Clients don't like it when the doctor, human or veterinary, is running behind. It affects the CSRs, our customer service representatives. It affects our technicians and our assistants. And so I thought it would be interesting just to kind of explain to you a typical day seeing appointments as a veterinarian and attempt to explain why sometimes we do run behind, but also explain how that then affects literally everybody, all of the support staff, and affects the clients and the patients. So most days that I work, I see appointments for 10 to 12 hours. And I have, if I'm seeing appointments for 10 hours, I have like a 1 hour lunch, and they're working lunches. So we do callbacks, we help with any cases that are in the hospital. You know, it allows us to address ongoing issues. We can review blood work, and if we have any like little procedures like a wound repair or further diagnostics like sedated x-rays, we can usually catch up during that time. If we have a 12-hour day of seeing appointments, then we have a 2-hour lunch. It's right in the middle of the day. It just kind of breaks it up, but also again lets you catch up. That way, if you are running behind, which we're going to talk about, or if you have a lot of callbacks, blood work, you're not staying until 10 o'clock at night to try and finish everything, because by that point, nobody really wants you to call them anyway. So our appointments start, at least at Independent Hill in Montclair, at 8 a.m. And we have different types of appointments. We have wellness appointments, which those are your well checks. And for patients, for dogs under 8 years of age, we recommend those annually. Over 8 years, we recommend every 6 months. For cats less than 10, it's annually. And then over 10, it's every 6 months. And those appointments range between 20 to 30 minutes. And the reason there's a variety is if we've seen the patient recently, or it's a young, healthy pet who's receiving vaccines or their wellness appointment or titers, then generally there is not a lot of concerns or complaints that need to be addressed by the client. So we do our physical exam, we address the issues found during the exam, we talk about diet, we talk about dental health, we talk about exercise and weight, and we give vaccines or run blood work, like if we're doing a heartworm test or wellness blood work, and then we move on to our next appointment. If it's a senior pet, then frequently we will make it a 30-minute appointment, because as everybody knows, unfortunately, as we get older, we get more problems, and that just gives us more of a cushion to talk with clients to discuss those issues so that we don't forget anything. So we have wellness appointments. We have what we call medical progress exams or recheck exams, and those are generally 20 minutes. And those are problems that we've seen before that we're now, a few days to a week to 2 weeks to a month, rechecking to make sure that everything is going according to plan and the issues are resolving. We have medical appointments, and those range between 30 to 40 minutes. And those are really for anything like ear infections, eye issues, vomiting, diarrhea, lameness. So that kind of runs the gamut of problems that we see. And then for me, I have my integrative appointments, and those range anywhere between 30 to 60 minutes. The initial appointment is an hour long, and then afterwards, the way I kind of do it is, realistically, you can have as much time as you want for us to discuss, and we can do acupuncture and chiropractic, and the price of the exam includes literally everything that we're going to do. It's just based on time. And that kind of comes with experience as far as who's going to need what time. Again, everybody's initial exam is an hour, and then usually the follow-up is 40 minutes. And then based on that, we can determine, okay, do I need 40? Do I need 30? Do I need 50? and then we'll charge accordingly based on the length of time. And then we have emergency appointments or walk-ins, and we encourage scheduling, but if an animal walks in, then it's going to be seen. It just may not be seen as soon as it walks in, but if they walk into the building and there's a problem, we're happy to see them. If there's an emergency and they need to come in, then we'll see them as well. And emergency appointments, generally we don't necessarily schedule as like a certain amount of time because they're usually like a squeeze in into the appointment slots. But if there is an opening, then we'll put the emergency there. So you have, let's say your 8 a.m. appointment, right? You get there, it's a well check, it's a 20-minute well check, it takes you 30 minutes. Well, the way that our appointments are set up is first the assistant goes in, they do a weight and a TPR, which is the temperature, pulse, respiration, which we talked about in the wellness sections, and they get a brief history, and they go over at Independent Hill and Montclair, they go over the wellness protocols. So for that pet's age, what we usually recommend, what the pet is currently due for, it kind of sets up the appointment to let us and the clients know what direction we're going to go in. Then the veterinarian goes in and does their exam. And let's say it's a 5-year-old dog that the client has noticed it's been gaining weight and wants to talk about food and the amount of food to feed. And you do the exam and it's relatively unremarkable, but you do notice that they have a lot of dental tartar and you notice that they're starting to get a little stiff in their hips. Well, the dental tartar is one issue. The stiffness in the hips is probably related to the weight. So then you can address the weight as well as potentially changing the diet and advising on the amount to feed. And there is a way to calculate what are called kilocalories, which is honestly the exact same thing as calories. It just, I think, makes us sound fancier. So we use that to help determine how much for the pet to feed. So if it takes your assistant about 5 to 7 minutes to load the appointment, right, and you have a 20-minute appointment slot, and then you go in and you do your exam, and then you talk, then you may not be done for, let's say, a total of 30 minutes. Okay, so this was an 8 o'clock appointment. It was supposed to be over by 8:20. It's now 8:30, but remember you have that buffer, right? So as the veterinarian is just discussing issues with the client, the vet assistant is in the room to hold, but they don't need to be in there when you're just talking about issues. And as long as you don't need them to fill medications, then they can step out and load your next appointment. So in theory, even though you are quote unquote running behind, your vet assistant is loading your 8:20 appointment. So by the time they're done loading it, you'll be out of your 8 o'clock appointment and ready to go into your 8:20 appointment. And to be honest, usually within the first 1 to 2 hours, that's when, if you're going to get behind, you get behind, because what'll happen is, and you know, it's just kind of the way it goes. And it's not because people are trying to be rude, and it's not because veterinarians are trying to be rude. It's just life happens. And so let's say you go into your second appointment, right? And it's an ear infection. And you walk in and there's 2 dogs in the room, and you think, all right, well, am I examining both? Is one here for a technician appointment, which generally technician appointments are done by our licensed technicians or the assistants, and those include things like nail trims, vaccines, blood draws, anal gland expressions, ear cleaning. And so you walk in and you talk about, we'll call him Fluffy, right? So the first pet who's there for an ear infection. And then, oh, by the way, you know, we'll call him Bailey. Bailey has also been itching, but not so much the ears. We've really been biting our tail area and we've been scooting. Do you think you could take a look? So then this 30-minute check ears is now a 30-minute 2-pet, because in veterinary medicine, at least, we really are not in a position to say no, because the animal's there. We have this, veterinary oath in the back of our head, do no harm, and we want to help them. So we don't want to say, oh, you need to schedule another appointment and come back. So we, quote unquote, fit them in. So then we look at 2 pets and we try and get it done as fast as possible, providing best medicine to both. So that's, like I said, usually when we start getting behind, because unfortunately it's fairly impossible to see 2 pets with 2 different problems, even if they're with the same family, in that 30-minute time period. Or it may not be that 2 pets came in. It may be that one of our clients is running behind. And we generally have, at Independent Hill and Montclair, we try to have about a 15-minute cutoff. So if they're going to be more than 15 minutes late and they know that ahead of time, then we do request that they reschedule. But to be honest, if they show up, they show up. And the way I work is if they come in and they have an appointment or they had an appointment, I'll still see them. But again, I might just have to fit them in. So if one client runs behind, then it does unfortunately affect the veterinarian and put them behind. And sometimes people will say, well, I don't come on time because I know the veterinarian's going to run behind. And unfortunately, that just kind of perpetuates the cycle because, if you think they're going to run behind and then you show up late, then they're definitely going to run behind for the future appointments. And for me, for things like acupuncture, I can frequently catch up with my appointments because I can assess the patient, see how they're doing, place the needles, and then they sit in for about 15 minutes, which can allow me to, if I am behind, see other appointments or address other issues. So it's, and you might think, well, why don't you schedule it differently? Unfortunately, that's almost impossible just because we have no idea who's going to call and when they're going to schedule. And in human medicine, they're very particular about what appointments goes where and how long those appointments are. And they're very strict about not allowing you to be seen if you're over a particular amount of minutes late. And they have things like no-show fees, right? So if you schedule a human doctor appointment and you don't show up, then you usually owe between like $25 to $65 just for the no-show. And we don't have that in veterinary medicine. And it is possible sometimes for clients to no-show, unfortunately. And if it's an integrative client, it is has a little more lasting effect because, especially if they're an initial integrative, then that's an hour long that we had reserved that we no longer have reserved. But in veterinary medicine, as a general rule, we do not have late charges or no-show fees. So if clients are running behind, then, even if they're 5 minutes late, sometimes that then puts us behind. If there's additional problems than we originally thought, because sometimes, especially for senior wellness, and that's why we try to keep them at 30 minutes, it's usually not just, oh, they're doing fine. It's, oh, hey, doc, he's been shaking his head a lot, or he's really stiff, or a lot of times we'll get he's been vomiting off and on for 4 weeks, and I knew it was time for the wellness, so I figured I'd just bring him in and you could get everything done at the same time. And I totally, and I'm not judging at all, I totally understand where that's coming from, because in your mind, oh, well, there's a problem, it's continued, it needs to be addressed, and hey, they need their shots. But unfortunately, for the most part, that's not how it works, because if they're not healthy, then we don't want to vaccinate them. And I think sometimes that's frustrating for clients because the gut reaction is, oh, you want me to come back, so I have to pay for another exam. And that's not the rationale behind it. The rationale is it's what we call a well check, right? And if they're not well, then we don't want to treat them as if they're well. We want to address them differently. And in human medicine, I think sometimes that's actually a little bit easier to deal with because of insurance coding. Like if you go in for so I have a 2-year-old, right? We take him in for his 2-year-old exam and it's a well check. The way that our insurance is set up, we don't have a copay because it's preventative medicine. But if I bring him in and he's having diarrhea or he's been running a fever for 3 days, they are not going to code that as a well check. And so they're not going to be able to address any of the wellness issues. So like any vaccines or discuss like the statistics they do. They do a lot of measuring for toddlers because that's not how it's coded through insurance. In veterinary medicine, we don't deal with insurance like that. But the rationale is similar. If they're sick, then we don't want to treat them like they're well because we don't want to give them vaccines if they're vomiting. We don't want to ignore a problem. And we will want to reevaluate. And frequently at the reevaluation, which may be a shorter period, we can then count that as the wellness appointment, but we don't want to vaccinate them when they're not healthy. And so having patients come in that have bigger issues than we thought. Other problems would be if we have like a lameness and or a coughing dog and we need to take x-rays. We have digital x-rays, which is great, and it definitely shortens the process, but there's still a fair amount involved. So you generally need 2 people to take the x-rays, and they have to wear their PPE or personal protective equipment. So the lead gowns, the thyroid shield, the gloves. We have to place the animal